Miss Compton?
Yes.
All right. How are you feeling today?
I'm good.
All right. Well, my name's Shannon. I'm going to be your nurse today, and I just have some questions to ask you. I see that you're here for your 4-week postpartum checkup.
I am, yes.
All right. And it looks like all of your vitals are normal and normal blood pressure, everything. You said you're feeling okay. Are you having any pain or nausea, vomiting at home?
No, I'm not.
All right. And how are you having any trouble sleeping, or are you getting enough sleep?
Just a normal having a newborn.
Okay. And how many kids do you have?
This was my 9th baby.
Okay. 9 children. Wow. All right. And how's breastfeeding going for you?
No problems.
All right. And then let's see. Has the provider talked to you about birth control before you had your baby?
No, they did not.
Okay. And were you on birth control?
I was taking a birth control pill.
Okay. All right. And were you liking the pill, or did you want to discuss birth control today?
I came in to discuss getting my tubes tied. I had difficulty kind of remembering to take it every day. With 8 kids, it's kind of hard to keep track.
Okay. All right. Well, there's definitely a lot of options that we can talk about. You said you're interested in getting your tubes tied?
I am, yes.
Okay. And have you spoken to your husband about that?
We have. We just don't know exactly what goes along with that, side effects, how it kind of works.
Okay. Okay, so basically what getting your tubes tied is a tubal ligation. So what that basically means is they're blocking your fallopian tubes so that an egg won't be able to reach the uterus and implant inside the uterus.
Okay.
It is permanent, so that is something definitely to consider. Some people can have it reversed, but it's a very invasive procedure, and lots of times it isn't successful. It won't affect your menstrual cycle, so you'll still have your period. And also, it won't protect against any kind of sexually transmitted infections.
Okay.
So that's maybe something that you would want to discuss, but you said you're not sure you want to be sterile?
Yeah, I'm not sure. I'm 37, I have 9 kids, but also we're not positive that we are done having them.
Okay. Well, let's see here. There's lots of other options that you could have. Are you informed on a lot of the different kinds of birth control, or do you want me to go over a lot of these options with you? Some of these options?
I would prefer you go over them with me. I mean, I've heard of a couple of them. I'm just not sure what they entail.
Okay. Well, then I can explain quite a few of them for you here, and then maybe help you to pick the one that seems to fit your schedule and your lifestyle best.
Okay.
I'll start off with a few that are one-time use that you may have heard of. One is just spermicide, which is a foam or a jelly that can be inserted before sex, and it kills the sperm when it inserts you.
Okay.
This has to be done 30 minutes ahead of your intercourse. So that's something to be aware of, and this can increase a risk of infection, and it does not protect against STDs. Okay. Another option is just using a condom. I'm sure you probably know what a condom is, but there are a lot of risks that go with that, like improper use, and if the condom were to break, then you have a high risk of becoming pregnant again. There's also something known as a female condom. It works pretty similarly to a male condom. However, it can be inserted up to 8 hours before intercourse. And some of the women that use them say that they can be noisy. And 21% of women that use these end up getting pregnant. Wow. So that's something to be aware of as well. Another option is something called a diaphragm, which is a rubber dome that's you would place it over your cervix before sex. It has to be used with the spermicide that I described earlier. It's fitted by a doctor, and it lasts for 2 years, but you have to take it out during your period.
Okay.
These are another cheaper option as well. They're like $15 to $75, and they last for 2 years. So that's something good. All right, and then another option, obviously, these are more long-term options. You mentioned you were on the pill before. Basically, what the pill is doing for you is preventing ovulation, so it also helps with period symptoms. The one negative about that is having to take it regularly on a schedule. Is there a reason that you don't want to use the pill anymore?
I just couldn't remember taking the same schedule, and then I was getting my period more than once a month. So
Having bad side effects
Yeah.
and stuff. Okay. All right, well, have you ever heard of the patch?
I have, but I don't know the side effects of it.
Okay. Well, the patch basically would be something that you would have to keep on your skin. It's every 3 weeks you would replace it and place a new one. It also helps with period symptoms, so it can prevent cramping or lessen cramping. But the thing about the patch is that it can cause skin irritation. All right, so now I'll go more into something I think would be more likely to suit you. And these are implants. Also, you may have heard of Nexplanon. Basically, it's a little rod in your arm that will release hormones regularly, and it is a contraceptive. So these last around 3 years. The main thing with that is that you'll have to come in for an exam and come in again for insertion, and these can be pretty expensive, especially if your insurance isn't going to cover those. It can be around $400 to $800. So that's just something to note.
So I heard you gain weight on that. Is it true?
Yes, there's a lot of side effects that people note. There's problems with their cycles, weight gain, increased blood pressure, and a lot of other side effects that we can go over. Oh. Okay, so the next thing that I'll discuss with you is an IUD, which is an intrauterine device. There's 2 kinds, and they're both little devices around this big that a physician or a physician's assistant will insert into your cervix. They're long-lasting. So the first one I'll explain to you is the copper IUD, and this is the non-hormonal one. This can last for up to 10 years, and the success rate is really good. Fewer than 8 out of 1,000 women with the copper IUD end up getting pregnant. However, it can make your periods painful and longer.
Okay.
So then there's also hormonal IUDs. So these actually will affect your period, and they'll make them, at first, for the first 6 months or so, they can have negative effects, and you can have the symptoms and have more bleeding, but then over time it should make your period shorter and lighter.
Okay.
And there's 2 types of hormonal IUDs. One lasts 3 years and one lasts 5 years, so that's something you can discuss with your husband and think about if that's something you're interested in.
Okay.
Let's see. Have you ever been talked about, or have you and your husband ever talked about him maybe getting a vasectomy?
We did, but we're not sure if that's permanent or if you can reverse it. So
Okay. So if none of these options sound doable for you and you want to maybe go down that route, what a vasectomy is the doctor will surgically close his vas deferens, which is a tube that carries the sperm. the thing to know about this is that it is mostly non-reversible. There is a surgery that can reverse it. Again, sometimes it's not effective, so that's just something to note. It's a risk that goes along with having a vasectomy. And also, it's not immediately effective, so you'll want to use another form of birth control until he is able to come back in after the procedure to test to make sure that he's not ejaculating sperm. Okay. And then let's see. Are you a smoker?
Yes.
Okay. So that's another thing to note. For smokers, it's not really recommended to use the pill or the ring or the patch, just because of interactions that can occur. But what could work for you is the shot. We talked about the depot shot that can eventually be self-administered. The shot is also going to be helpful with premenopausal symptoms. So if you're getting up there to closer to the age where you think you might be experiencing menopausal symptoms, the shot can be good with helping for those. Some side effects with the shot is going to be weight gain, depression, nausea, headaches, and irregular periods, but those usually subside in about 2 to 3 months.
Yeah.
Another thing to note about the shot is that you can stop getting it at any point, but it might take 9 to 10 months for your body to be able to be impregnated after that. All right. Let's see. Do you have any questions about any of those?
No, I think you explained them pretty good.
Okay. And then I'll just go over to make sure that you're aware of everything. The tubal ligation, just so that I know that you asked about that initially. It can be done following a vaginal birth or during a C-section, but since it's been several weeks since you gave birth, it would be an outpatient procedure for you, and that would entail general anesthesia.
Okay.
We would have to give you a pregnancy test first, just to make sure. And the risks of tubal ligation include damage to the surrounding organs like the bowel, bladder, and major blood vessels. You could have a reaction to anesthesia. It puts you at a risk for infection or improper wound healing, and you may have some pelvic and abdominal pain. A huge risk with this is an unwanted or ectopic pregnancy when the egg actually does implant in the fallopian tubes, and that can be life-threatening.
Okay.
Do you have a history of diabetes or of any pelvic or abdominal surgeries?
No.
Okay. Because that also puts you at a high risk for adverse effects after getting your tube types. All right. Well, do you have any preferences, or do any of those options sound like you'd be interested?
Right now, I think I want to do the hormonal IUD, and then maybe in a couple of years, I'll think about the shot when my premenopause.
Okay, awesome. Well, I will let the OBGYN know that that is the route you would like to go down, and they will come in and do a quick assessment and figure out which one is right for you.
Okay, thank you.
All right. Have a great day, Miss Compton.
You too.